Over 80% of adults over the age of 60 have a metabolic problem that is silently damaging their heart, their brain, and their energy levels, and their doctor has never once brought it up in conversation. It does not show up on a standard cholesterol test. It does not always cause obvious symptoms. And most people walking around with it have no idea it is happening inside their body right now. This problem is called metabolic dysfunction, and it is the hidden engine driving some of the most common and most serious health complaints that older adults experience every single day. Fatigue, belly fat, brain fog, high blood pressure, poor sleep, joint pain, all connected, all rooted in the same underlying problem. Today, I am going to explain exactly what this is, why it gets worse after 60, and what you can do about it, starting this week. I will give you a ranked list of the most effective strategies, a simple daily plan, and the mistakes you absolutely must avoid. Stay with me. This one could change everything. The root cause. What is really happening after 60? The word metabolism gets used a lot, but most people think it just means how fast or slow you burn calories. It is actually much more than that. Your metabolism is the entire system your body uses to convert food into energy, and then use that energy to keep every organ, every cell, and every process running properly. Think of your metabolism like a power plant. When you are young, that power plant runs efficiently. Fuel goes in, energy comes out. Everything stays balanced. But after the age of 60, several things happen at the same time. Your muscle mass decreases, and muscle is one of the main places where your body burns fuel. Your mitochondria, the tiny energy-producing engines inside your cells, start working less efficiently, and your hormone levels shift, reducing the signals that tell your body to burn fat and build muscle. The result? The power plant starts running poorly. Fuel, in the form of glucose and fat, stops being burned efficiently. It starts accumulating in your blood, in your tissues, around your organs. This is what we call metabolic dysfunction, and it creates a cascade of problems throughout your entire body. Here is the important part. This is not your fault. It is a natural biological shift. But, and this is critical, it is not irreversible. The right habits can genuinely restart that power plant. Your body has a remarkable capacity to recover when you give it what it needs. How the solutions work, the science in plain language. Now, before I give you the list, I want you to understand why these strategies actually work. Because when you understand the why, you are far more likely to stay consistent. Every strategy I am about to share works through one or more of these three pathways. First, preserving and rebuilding muscle tissue. Because muscle is metabolically active. The more muscle you maintain, the more efficiently your body burns energy at rest. Second, improving mitochondrial function. Your mitochondria respond to specific nutrients, movement patterns, and lifestyle signals. When you support them correctly, your cells produce energy more efficiently. Third, reducing chronic low-grade inflammation. This type of inflammation, sometimes called inflammaging, is now understood to be one of the primary drivers of metabolic dysfunction in older adults. Dozens of studies confirm that reducing this inflammation directly improves metabolic health. These are not trends. They are not supplements being sold to you. This is biology, and it responds to the right inputs consistently. The strategies, ranked from least to most effective. Strategy number 1, cutting calories aggressively. Score, 4 out of 10. Many people think the answer to metabolic problems is simply eating less. But severe calorie restriction in adults over 60 often accelerates muscle loss, which makes metabolic dysfunction worse, not better. Studies show that older adults who drastically cut calories without preserving protein often lose significant muscle mass within 8 to 12 weeks. The practical tip: do not focus on eating less. Focus on eating better. Quality over restriction. Strategy number 2, low-intensity daily walking. Score, 5 out of 10. Walking is beneficial, and I absolutely recommend it. But walking alone, without other forms of movement, has limited impact on metabolic dysfunction. Research shows it improves cardiovascular health, but does not significantly rebuild muscle or restore mitochondrial efficiency. The practical tip: use walking as your daily foundation, but do not rely on it as your only tool. It works best combined with strategies higher on this list. Strategy number 3, reducing refined sugar and processed carbohydrates. Score, 6 out of 10. This one matters more than most people realize. Refined sugar and white flour products cause rapid blood sugar spikes that stress your metabolic system repeatedly throughout the day. Over time, this contributes directly to insulin resistance, one of the core features of metabolic dysfunction. Research shows that reducing added sugars alone can improve fasting blood sugar by 10 to 15% within 4 weeks in adults over 60. Warning: do not replace sugar with artificial sweeteners carelessly. Some sweeteners disrupt gut bacteria, which also plays a role in metabolic health. Practical tip: begin by removing one processed carbohydrate from your daily routine this week. One swap at a time. Strategy number 4, prioritizing quality sleep. Score, 7 out of 10. This one surprises people. But sleep is not passive. During deep sleep, your body regulates cortisol, repairs muscle tissue, and resets insulin sensitivity. Studies consistently show that adults sleeping fewer than 6 hours per night have significantly worse metabolic markers, including higher blood sugar, more belly fat, and lower energy. One study found that just 5 nights of poor sleep increased insulin resistance by nearly 25%, equivalent to gaining over 20 pounds of body fat in terms of metabolic impact. Practical tip: create a consistent sleep schedule. Same bedtime, same wake time. Avoid screens for 30 minutes before bed. This single habit has measurable metabolic benefits within 2 weeks. Strategy number 5, increasing daily protein intake. Score, 7 out of 10. After 60, your body becomes less efficient at using dietary protein to build and preserve muscle. This means you actually need more protein than you did at 40, not less. Most older adults are significantly undereating protein. Research recommends at least 1.2 grams of protein per kilogram of body weight for adults over 60. That is roughly 80 to 100 grams per day for most people. Practical tip: add a protein source to every single meal. Eggs, Greek yogurt, legumes, fish, or poultry. Even adding protein to breakfast alone has been shown to reduce muscle loss and improve metabolic markers over 8 weeks. Strategy number 6, managing chronic stress. Score, 7 out of 10. Chronic stress keeps cortisol, your stress hormone, elevated for long periods. And elevated cortisol directly breaks down muscle, raises blood sugar, and promotes fat storage around the abdomen. It is one of the most underestimated drivers of metabolic dysfunction in older adults. Studies show that simple stress reduction practices, including deep breathing, prayer, gentle yoga, or even quiet time in nature, can lower cortisol by 15 to 20% within 4 weeks. Practical tip: build 10 minutes of quiet, intentional rest into your day. Not screen time, not news, actual stillness. Your metabolism will thank you. Strategy number 7, resistance training 2 to 3 times per week. Score, 8 out of 10. This is the most powerful tool for rebuilding metabolic function and the most avoided. Many older adults fear resistance training. They worry about injury. But research is clear: light to moderate resistance training, using body weight, resistance bands, or light dumbbells, is both safe and transformative for adults over 60. Multiple studies show that consistent resistance training over 12 weeks can increase muscle mass by 5 to 10%, improve insulin sensitivity by up to 40%, and significantly reduce markers of metabolic dysfunction. Important warning: start slowly. Begin with bodyweight exercises like wall push-ups, seated leg raises, and chair squats. Intensity is not the goal at first. Consistency is. Practical tip: 3 sessions per week, 20 minutes each. You will feel the difference within 3 weeks. Strategy number 8, supporting gut health. Score, 8 out of 10. Your gut microbiome, the trillions of bacteria living in your digestive system, plays a direct role in how your body processes food, manages inflammation, and regulates blood sugar. And after 60, gut diversity naturally declines, which worsens metabolic health. Research published over the past decade has consistently linked poor gut health to increased belly fat, higher blood sugar, and greater systemic inflammation, all hallmarks of metabolic dysfunction. Practical tip: add fermented foods, yogurt with live cultures, kefir, sauerkraut, or kimchi to your daily diet. Also increase fiber from vegetables and legumes to feed beneficial bacteria. 2 to 4 weeks of consistent effort produces measurable shifts in gut composition. Strategy number 9, time-restricted eating. Score, 9 out of 10. This does not mean fasting aggressively. It simply means eating your meals within a consistent 8 to 10-hour window each day. For example, between 8 in the morning and 6 in the evening. During the remaining hours, your body shifts into a repair and fat-burning mode. Research in older adults shows that time-restricted eating, without changing what you eat, can reduce belly fat by 3 to 4%, lower fasting blood sugar, and significantly improve mitochondrial efficiency over 8 weeks. Warning: if you take medication with food or have a history of low blood sugar, talk to your doctor before adjusting your eating window. Practical tip: start by simply not eating after 7 in the evening. That alone is a meaningful first step. Strategy number 10, combining movement with nutrition timing. Score, 10 out of 10, most powerful. The single most effective thing you can do for your metabolic health is move your body within 30 to 60 minutes of eating and eat enough protein to support that movement. When you combine post-meal movement with adequate protein, you activate something called GLUT, 4 pathways in your muscle cells. This allows your muscles to absorb glucose without needing insulin. It directly bypasses the insulin resistance that drives metabolic dysfunction. Studies show this combination, consistent post-meal movement and adequate protein, produces greater improvements in metabolic markers than either approach alone. In some trials, participants saw their fasting blood sugar drop by 20 to 25 points within 6 weeks. Practical tip: after your largest meal of the day, walk for 15 minutes. And make sure that meal contains at least 25 to 30 grams of protein. This is the combination your metabolism needs most. Your implementation plan. Here is exactly how to start. This week, focus on 2 things only. First, add a protein-rich breakfast every morning: eggs, yogurt, or legumes. Second, take a 15-minute walk after dinner every night. Do not change anything else yet. After 1 week, add 1 serving of fermented food per day, and begin going to bed 30 minutes earlier than you currently do. At 3 days, many people feel a slight shift in energy, especially in the afternoon. At 1 week, sleep often improves and post-meal fatigue starts to reduce. At 2 weeks, if you have been consistent with movement and protein, you may notice your clothes fitting slightly differently around the waist and your mind feeling clearer. At 1 month, measurable changes in blood sugar, energy, and body composition are well documented in the research. Talk to your doctor and ask for a metabolic panel at your next visit to see the numbers for yourself. Small daily habits create big results over time. That is not a motivational phrase. It is what the science shows. If this video gave you something valuable, please give it a like, subscribe so you never miss a video like this one, and share it with a family member or friend who needs to hear this. You may be doing them one of the greatest favors of their life. Take care of yourself. We will see you in the next one.